Right. So now we're going to turn to a discussion on harm reduction on tribal lands. So please join me in welcoming Cathy Chavers, former Bois Forte Tribe Chair, and the Honorable Philomena Kebec, Economic Development Coordinator for the Bad River Band of Lake Superior, Chippewa, and Chief Judge for the Sokaogon Chippewa Community Tribal Court. Nice to see you both again.
Yes, it's a pleasure. Thank you.
So we're here to talk about harm reduction, which is a term that has been around for ages and has gotten a lot more notoriety in recent years. And I've heard people define it in all sorts of different ways. I generally go with, it's a way of keeping people who are using drugs as safe and as healthy as possible. But I also think it's helpful to define it by giving examples. And so I want to start off by asking you both, can you share an example of a harm reduction strategy on tribal lands and tribal communities that has been successful? Philomena?
Go ahead, Philomena.
Oh, okay. Sure. So our program has very humble beginnings. And in the beginning, 10 years ago when we started, we didn't have any money, any building, or really much support from local public health. So we got a free phone number and some supplies from the Wisconsin AIDS Resource Center. And we started just doing deliveries, harm reduction deliveries, right? And we live in a rural area. We were covering much of Highway 2 in northern Wisconsin. It became a lot because we found that there was a really great need. And when we received operational funding, we changed this model to a paid contractor model. So we pay community members to deliver harm reduction supplies in a 4-county area. And they're paid by the data record that they produce. And that data record includes like just a lot of information about what happened, including a record on the number of overdoses that the person reported to them.
That's wonderful. The data collection kind of really shores up the intervention.
And it's seamless, right? So we know how to pay them, and we also receive this data, and they're paid for that data in a way that is consistent with harm reduction principles.
Absolutely. Cathy, what about you? What is a harm reduction intervention that you've seen be successful in your community?
Yes, we at Bois Forte are located in northern Minnesota, one road in, one road out. And we had the fortunate to have Dr. Melissa Walls and Sean Allen connected with our health facility. And tribes, we're very rural and very small. And we don't have opportunities to collaborate very often with organizations because we aren't aware of them or we don't know about them. And so Sean and Dr. Walls helped us get vending machines, public vending machines. We have the harm reduction machines. They're the first in the Minnesota tribal communities, and they have been very successful. We have 2 sectors of our reservation, and we put one in our Vermilion casino, and then in that lake we put one in our convenience store, our C-store. That's the only store in the village. And so they're out of sight, so people have privacy. But in those vending machines are naloxone, fentanyl testing strips, socks, anything that people would want access to, HIV testing, pregnancy tests, and those machines are working great. We get monthly reports telling us which ones are the most popular and which ones are not being used, and then we can switch them out. It did take a while to get the machine because they're so big products not like a candy bar to come out of the machine. But they've been very successful, and we're very proud to have that because it has reduced our overdoses at Bois Forte because they do have that access to all those things that they need, because most of them are low income, homeless, some of them are homeless, and they just don't know where to access it. Transportation is a huge issue for Bois Forte. One road in, one road out. We're 65 miles from a major town. And so we need that there to help our people. So with that, that's what we have is our harm reduction machines. We're very, very pleased to have them.
That's excellent. And so both of you are clearly, champions of harm reduction. You're also both leaders in your communities. How have you used those leadership roles to champion harm reduction, to maybe talk to folks who don't agree with it or are not on board? How have your roles helped you make that change?
With Bois Forte, it's frustrating being a former tribal leader. And I worked in the healthcare industry for 30 plus years. And I get frustrated with politics, really. Even today, I sit back and I just shake my head because every day is different. We need our health. We need to protect our members. We need to make sure that we all have good lives and are healthy. And tribal councils are different. They are, like our tribal council is not really educated. Tribes are different when they have their elections, and it's really hard to explain, but we really like to have people come to the reservation to see us. One thing that I've tried to do as a tribal leader is to build those collaborations and partnerships, because we don't have the ability to do what we have. We don't have the data. Small tribes don't have data. We don't have the opportunities that the outside world has. And so we value anybody that comes to us and says, hey, I've got an idea. But remember, when you do that, make sure it's at the beginning of everything you think about, because as tribal leaders, sometimes we're asked, hey, what do you think about this? We've worked on this project for like 6 months now, and that doesn't work. You have to get the tribes involved from the beginning. If you have ideas, bring the tribes in at the beginning. They don't do that. They bring us in the middle or at the end and say, hey, we've got this great program. We don't get direct funding from our state agencies. We need direct funding. They include us in their counties. We don't get that funding. We're not local governments. We have to go to the legislature. We have to kick their shins once in a while to wake them up. People don't know about tribes because our history's never been told. They don't know that we're not a race. We have political status, special political status. We're not a race. Minnesota, we don't use the term BIPOC. We don't want to be included with that because we're a special political status. So with that, I just want to say, if you have an idea, come see us, because we're open to that. We have very small resources, small staff. We can't recruit. We're fighting the outside world. And we're also fighting our tribal councils to realize that healthcare is important, prevention is important. Thank you. Thank
you. So as an attorney, I often see myself as bridging a lot of worlds, right? And there's many people who have, I've visited with my tribal members who are pregnant in jail and experiencing real severe, intense trauma. And then I come before the tribal council and tell, like stories about what I've seen, right? And so oftentimes my leadership is related to bridging communities and translating those worlds. And what I try to do intentionally is to give away my political capital, because the people that I work for are people who use drugs, and they're often villainized. And it's really important to highlight their strengths, their leadership, and their stories in order to ensure that we have good public health strategies. Mm-hmm.
Absolutely. So just a few minutes left. I want to ask each of you if there's one sort of challenge and a critical resource that would help you address that challenge. I think, Philomena, you talked about the changing drug supply.
Yeah, I mean, what we've seen in the past 6 months is our overdose reversal reports going way down. So a 5-fold decrease in overdoses actually occurring in our local community. And in talking to our contractors, who include people who use drugs actively, what we found is that the drug supply has really reduced in potency in our local area. And so, that seems like a good thing, right? And we've seen many people much more interested in treatment. But what it has also resulted in is a migration to cities. And so many of the people who are at higher risk for overdose are no longer in our community. We can't take care of them. They're living on the street in Duluth. And this is very dangerous. We just had a tribal member suffer an incredibly, a life-threatening sepsis infection because she was out there and not coming back to us and getting like the community care that we can provide in Bad River. So having access to all forms of treatment, including methadone, is critical. We do not have that right now, and it's a major deficit.
With Bois Forte, it's like, or with us, it's the challenge is getting providers. We don't have counselors. We are an aging population in our workforce. We're fighting, I always say we're fighting, I'm sorry. We're challenged by the outside world because they have tons of money to recruit and retain people. We're 50 miles from the Canadian border, 60 miles from a major facility. And so a lot of people don't want to come to the rural areas. And that's a challenge. That's a very big challenge. We don't have access to treatment. If somebody wants to go to treatment today, I don't know if they'll find a bed. We don't have adolescent treatment. We have one in Minnesota. It's really sad. The need is great, but the access is not there. We need those facilities desperately because our people are dying. All people are dying. And we need to help in prevention. We need to get our elders involved. Our elders are our caregivers also of these children, of the people that are suffering and out battling this addiction. So I just want to say that, you know, anything, I'm desperate here, anything anybody can do or have an idea, please talk to the tribes. We have the highest health disparities of anybody in the country. And why is that? Maybe because we're invisible. People don't think about Native Americans, they think about Caucasian, Asian, blacks. That's all you see on the data. So, miigwech.
Yeah, it sounds like the challenges are really severe, but there's also a lot of opportunity
Yep.
for relationship building and folks working together.
Yes, collaborations and partnerships work.
All right. Well, thank you both so much for sharing your expertise today. We appreciate it.
Thank you.